Good morning. This G Butterfly, and I'm coming to you live from the parking lot. It's Monday morning. We're headed into a long holiday weekend, so everybody's going to be excited this week, probably doing a little extra work. Probably not. You know, folks going to be calling in come Thursday and Friday, but that'll be another video. Now, what I want to talk about today, I had a conversation with a friend last week, and what she said to me was a little concerning, but I want to know, what do you think? In my comments, let me know, what do you think about this particular scenario? She was sick and wasn't feeling well and went to the emergency room. She was in the emergency room for multiple hours, and she had one nurse. It was a female nurse. And she said the female nurse was very nice and talked to her, just chit-chatting on and off, coming in and out of the room. And I don't know if the nurse told her that she was gay or bisexual. She said she didn't feel well and they just kept talking. She said, but she noticed the nurse was a little flirtatious. She said, but she didn't feel good and she didn't really pay that much attention to it. She was just trying to figure out what was wrong with her, why she was sick, and focus on getting well so she can get home. Well, long story short is, when she went home, the nurse started calling her. And she said she didn't know how to really handle that. And she said she couldn't understand why the nurse was calling her and she never answered the phone. And she kind of felt a little uncomfortable. And I say, well, what did she say? Well, she said the nurse actually had asked her to go out and, something which was inappropriate based on her profession and how she met her. Now, why would she call her after the fact? And she said, I really don't know what to do. I said, well, let me ask you this question. How would you feel if it was a man doing that to you? Would you feel uncomfortable? Would you feel like he was crossing the line because he got your number and started calling you based on you being in the emergency room and that was your contact with them? I say it's almost the same as if you're going to the OB/GYN and you have an exam and then he's calling you next week trying to go out on a date. Highly unethical, shows a lack of professionalism. So what is the difference between a woman doing it? Now, I asked her, I say, I wonder if she does this on a regular to other female patients that she may find interesting, attractive, think may be interested in her. But I told her, I said, you know what? That's not good. I say, because I bet you she's doing it to other women, and she may be using her position and profession as a way to prey on women and to try to find women to date. Just like I'm assuming men probably do it too. So I asked her, I said, well, what are you going to do? She said, I'm really not sure. She said, I just don't answer the phone when she calls. So what would you do? Would you call and it's a local hospital right here in Houston, a very well-known hospital where she was being seen. And the lady worked there as a nurse in the emergency room. And she just said that she was a little uncomfortable. So what would you do? Would you answer the phone, have a conversation, or tell her, please don't call me again, I'm not interested, why did you call my phone, how did you get my number? Or would you call the hospital to report her for harassing you and asking to go out on a date after they got your number because you were in the emergency room? I'm really curious of what would you do, because I'm quite sure some people may not see anything wrong with that. Some people may be a little concerned. Some people may just blow it off and just act like it's nothing. Or some people may be frightened because it is a form of sexual harassment. So what would you do? In my comments, let me know what position you would take with this. All righty, well, it's G Butterfly, and I'm coming to you live from the parking lot on a Monday morning. Talk to you later.